No, Nipah virus is a viral infection that originated in Malaysia in 1998. No? So the first outbreak of a Nipah virus-related infections was documented in Malaysia, and the name itself, Nipah, is also part of that area where the first outbreak was documented. No? And for several years now, most of the outbreaks of Nipah are situated here in Asia. No? Maraming mga bansa, kagaya ng Bangladesh, also had several of these outbreaks. And lately, itong India, part of Kerala, I think this is their third or fourth outbreak na nakikita nila. And alam natin na this virus is being carried by fruit bat, yung panike. And this is also not common in this area na itong type of fruit bat are common in this area. And that's why the microorganism, yung virus na yan, when they are carried by that fruit bat and being handled by a human being, that's the only transmission that has been documented. No? So manggagaling sa bat and then being handled by a human being. So nanggagaling yung infection sa bat. No? But in this new outbreak, I think ang nakikita nila ngayon is that there are those people who handled those who were infected that are also being infected by humans. So meron na sila nakitang human-to-human transmission. And that's why tumataas ang mga kaso nito ngayon dito sa Kerala, India. No? And isa sa mga characteristic ng Nipah virus is that it will really be fatal because of its ability to infect the brain, no? Yung tinatawag natin na encephalitis. So encephalitis is inflammation of the brain. And you can just imagine when you have an infection that causes inflammation of the brain, it will also affect other functions of other organs, particularly the heart, the lungs, and doon nakikita natin na it can also be a multi-organ infection and can be fatal and deadly. There are unvalidated report na halimbawa if you are handling these bats, no, and kakainin mo and you did not cook it properly, alam naman natin sa may mga ganong ginagawa, no, yung mga ibang bansa na talagang because of practice na pwedeng kinakain nila, it can also be acquired through that route of transmission. Pero Nina, ang pinaka-common route of transmission is really handling these bats, the fluid, the body fluids, anything that is coming from that bat. Tapos, galing sa kamay, and then you're not washing your hands, doon, papasok yan anywhere sa mouth, sa eyes, or even doon sa mga area na may mga sugat tayo. And that's where the most common route or entry of the virus sa katawan ng tao. Tao na infected, kagaya ng nakikita nila ngayon, and being handled by some of those na hindi alam nila na meron na palang Nipah virus. So, the body fluids of those who are being infected, na ma-expose yung tao na handling that infected individual without the gloves, without washing their hands, and then touching their face, touching their mouth, then that can also be another route of transmission. For one, when you have a Nipah virus infection, ang pinaka-most common manifestation ito is talagang merong lagnat, no? Because it's a systemic type of infection. Pangalawa, yung masakit ang katawan, mabigat, no? And then, this is also associated with severe headache dahil nga ang propensity ng virus na to is talagang dumidiretso siya sa brain, no? And pagkatapos niyan, after 2 to 3 days, yung tao maghihina, hindi na makakakilala, and then yung sensorium niya, no, hindi na siya palaging gising, natutulog, hanggang tulog na lang siya ng tulog, and then eventually humihinto yung function ng lungs niya, hindi na siya makahumihinga, at saka yung puso. And that's always the sequence of mga sintomas nitong klaseng virus ito. Napakataas dahil in fact doon sa mga previous outbreaks na document, no, in Bangladesh and in India, it ranged from 50 to 75% ang case fatality rate. So ibig sabihin For example, 5 ang infected, 3 doon or 4 can die of the infection basta hindi magapan. The other aspect here of the Nipah virus ngayon is that there's no treatment, no? So walang gamot to, walang antiviral, wala talagang maidapat na gamot dito na pwedeng makasave ng life, no? And that's the reason why mataas ang mortality. And at the moment, wala din tayong bakuna pangontra dito sa Nipah virus. Kagaya ng COVID, no, or even flu, no, these are also viral etiology, no, kagaya ng Nipah. But the propensity of this flu and COVID is mainly in the respiratory tract system natin, no, sa lungs. It starts with the throat and then sa lungs. Kaya meron tayong mga sore throat, no, pag-uubo, and then nahirapang huminga. This one is so totally different dahil ito ay lagnat and without respiratory symptoms. So, ibig sabihin, hindi ka dadaan doon sa pag-ubo, hindi ka dadaan doon sa naramdaman natin kagaya ng COVID na nahirapan tayong huminga. This one is that paglagnat ka lang, tapos 2 to 3 days, medyo humihina na yung sensorium mo, and then natutulog ka na lang, and then that's it. No? Huminto na yung paghinga mo at saka yung cardiovascular function. Sa mga patients or anybody who has manifestations like, ito kasi yung mga danger signs, no? Mayroon tayong tinatawag na danger signs. Pag meron kang lagnat, tapos may kahalong masakit ang ulo, dapat magpakonsulta ka na, no? Because anyone that has those 2 symptoms, sakit ng ulo, severe headache, tapos fever, then most likely you have an infection of the brain. Whether it's encephalitis or meningitis, that's so fatal, no? In fact, mayroon tayong mga ganyang klaseng mga other causes na hindi lang Nipah na that can also are as fatal as Nipah virus. Basta apektado na yung ulo mo, napaka-severe ng headache, at the same time you have fever, then these are the symptoms that you need to go to the doctor, consult, and then get some advice, diagnostic test, and most likely, depende rin yan sa status ng severity ng headache mo. Kailangan ka bang i-admit or kailangan ka lang bibigyan ng pain reliever. But importante, makita ka ng doktor para ma-monitor at ma-diagnose ka agad kung bakit ka meron kang ganong severe headache. Before the onset na patulog-tulog ka na and tuloy-tuloy na hindi ka na nagigising, which is already a severe form at irreversible form of the infection. Now, we have relatively the same virus na kahanay ng Nipah, no? We call it the Nipah virus infection. In 2014, na naitala sa Mindanao, no? Sa Sultan Kudarat, and this one nanggagaling din sa isang animal, no? Sa horse, in which the same manifestation as that of the Nipah. But for the Nipah virus alone, wala pa tayo, no? So, which means na we need to be vigilant about this, although it may be remote that it can happen here, or it will be yung mga nakikitang kaso natin sa India makapasok dito sa Pilipinas. But again, kailangan lang natin i-monitor ang mga kaso na to dahil in any country na nandito itong kagaya nitong infection na to, like a tropical country, the Philippines, that will also be a possible scenario. Importanteng yan, no? Kasi asthma, especially itong nangyayari ngayon na merong Taal volcano, no, nag-erupt, no. This may contain mga harmful chemicals, no, na nahihalo doon sa air. And ang napaka-vulnerable nito are those individual na meron ng mga lung conditions, no, like kagaya ng asthma or yung chronic obstructive pulmonary disease dahil because of smoking. So it can aggravate this type of lung disease na pwedeng magiging mas madalas na hinihingal, mas madaling matapuan ng infection, and at the same time yung danger nito na if it can be severe, it can also cause respiratory distress, no, nahirapang huminga, no. And that's why ang advice natin dito for those mga matatanda, those who are smokers, and those who have asthma, they have to wear something like an N95 mask for them to be protected, no? Because an N95 mask has a better filtering capacity compared to just an ordinary cloth mask or anything like a surgical mask. Importante na for the vulnerable population, Meron tayong mga bakuna to prevent respiratory infection, kagaya ng flu, pneumococcal vaccine, and pertussis. No? So, we need to get those kasi napaka-importante nun. Meron kang added layer of protection. Pangalawa, you have to keep yourself healthy. For those who have comorbidities like diabetes, mga asthma, or may mga hypertension, you have to maintain your medications para hindi ka maging unstable at hindi lalala. At pangatlo, if you have some of this vulnerable ka to this mga respiratory harmful effect ng air, then you have to wear face mask, and of course you have to be healthy. You have to eat healthy food, exercise, and tamang rest, no, or tulog, para at least yung katawan natin pwedeng lalaban doon sa mga infection. Itong mga harmful irritants sa air, especially smog, or more especially sa fog, napaka-pino nito, no? So, ibig sabihin, they're so fine that it can't penetrate readily. Pag mag-inhale ka, diretso na yan sa lungs, hindi na yan sasabit dito sa lalamunan mo, no? And that's the danger there, because kung lungs na ang diretso niyan, then that can really be harmful in terms of paghinga natin. So, we advise na gamitin natin N95 over the cloth mask or what we call the surgical mask.